Hello, my name is Joshua Sixon, a third-year internal medicine resident at University of Miami JFK, here to discuss a case of new-onset hemidiaphragm paralysis in a patient who received LVAD implantation. Short-term mechanical circulatory assist devices such as left ventricular assist devices, or LVAD, are increasingly being utilized in patients with advanced heart failure, either as bridge therapy to heart transplant or as destination therapy. Previous known complications of LVAD implantation include bleeding, postoperative infection, pump thrombosis, right heart failure, and even stroke. Previous known etiologies for diaphragmatic paralysis include viral infections, phrenic nerve injury due to cooling of the heart during surgeries such as CABG, and even cervical compression tumors. Here we discuss the case of a patient who developed new-onset elevated right hemidiaphragm after implantation of LVAD. The patient is a 32-year-old female with non-ischemic cardiomyopathy with left ventricular ejection fraction of 15%, pulmonary hypertension, diabetes, morbid obesity, polysubstance abuse, who presents for one-day history of shortness of breath, orthopnea, and leg swelling. The patient follows with heart failure clinic. She has been inotrope dependent for 6 months, and she reports good compliance with her medications. Her initial chest x-ray on presentation showed no acute processes. Her EKG showed sinus tachycardia, and NT-proBNP was slightly elevated at 193. Echocardiogram showed left ventricular ejection fraction of 25% with diffuse hypokinesis. The heart failure team was consulted, who recommended evaluation for LVAD. Patient underwent right heart cath as well, which showed decreased cardiac index of 2.04 liters per minute per meter squared while on milrinone. A multidisciplinary team, including pulmonary, infectious disease, psychiatry, and palliative care, were consulted for LVAD evaluation for placement as destination therapy. Since the patient was morbidly obese, she was not a candidate for transplants. Patient underwent LVAD placement with HeartMate 3, was placed on dobutamine and cardian drip, and was monitored in the ICU on mechanical ventilation. The next day, after her surgery, the patient experienced respiratory distress, fever with temperature 38.8, and leukocytosis. Chest x-ray was done, which showed right upper lobe opacity. The patient was started on empiric antibiotics, and cultures were drawn. A bronchoscopy was also done with bronchoalveolar lavage, and secretions were removed. Patient's respiratory status did improve, and she was extubated the next day to BiPAP. Repeat chest x-ray that day showed elevated right hemidiaphragm, which was not present on admission. A fluoroscopic sniff test was done, which shows elevation of the right hemidiaphragm with restricted motion during inspiration and expiration. Pulmonary hygiene was encouraged, including incentive spirometry and flutter valve, and the patient did improve symptomatically. She was subsequently weaned off of inotropes and discharged home on her chronic heart failure medications. So in the middle panel, here we see a few images. This first one is the chest x-ray that was done at admission, showed no evidence of acute cardiopulmonary disease. Image 2 shows the chest x-ray after LVAD, which shows the right elevated hemidiaphragm. And on the bottom of the middle panel, there was a fluoroscopic sniff test that was done. It's a dynamic study, so here we just have the SCOUT images, which shows elevation of the right hemidiaphragm and restricted motion during both inspiration and expiration, which expiration is on the left and inspiration being on the right. So, as the prevalence of heart failure continues to rise with an aging population, it is likely that more and more patients will receive LVAD, and more novel complications of LVAD will be uncovered. In our patient, it is difficult to establish causality between LVAD placement and development of hemidiaphragm. However, no other factors from this case were thought to have contributed to this event. Overall, more research is required to better understand the potential complications of LVAD implantation and implications for patients seeking this therapy, either as bridge to transplantation or, as in this patient's case, as destination therapy. Thank you.